Today we're going to demonstrate how we use the soft laser diode laser to manage the tissue of a smile design case. We're going to prepare 10 teeth, tooth numbers 4 through number 13. All 10 teeth will undergo crown lengthening procedures. Fortunately, periodontal disease is not a factor in this case. Prior to crown lengthening, periodontal probing was done on all teeth. We find it easier to perform the crown lengthening procedure prior to any tooth preparation to get the optimal harmony of the smile design. We will start on the right side, tooth numbers 4 through 8, and then we will go over to the left side and prepare tooth numbers 9 through 13. Feathering of the facial margins is also accomplished in order to eliminate the ledge effect of the tissue. Always take plenty of time. No need to rush it. The tissue just melts away with very little effort at a power setting of 1.2 watts with an initiated tip. Always maintain a light feather touch brush-like motion when using the fiber. And be sure to operate in a dry field. This is always more efficient than cutting in a wet field. After crown lengthening, you then go on and finish your crown preparations. And you are now able to access the interproximal spaces with your fiber. The laser gives you the confidence of knowing that you're not going to encounter bleeding when taking the impression. When you're dealing with 10 teeth at one time, this is the last thing you want. At first glance, it appears as though we've created quite a bit of tissue trauma. However, the patient in this case will feel very little, if any, postoperative discomfort. Healing is rapid and predictable, and there's no gingival recession. This will be evident later on when we see the final post-op of the completed restorations. We see here the opportunity to go in and clean up some of the tissue around where there was old PFM restorations. We will be placing full coverage lava crowns on this case. The total amount of time we spent in crown lengthening with these 10 teeth was approximately 10 minutes. And troughing takes approximately another 30 seconds per tooth. So all in all, we probably have about 20 minutes worth of total time dedicated to soft tissue interaction with the laser. We are now ready to go in with a brush and scrub the tissue right around the margins so it doesn't interfere with the impressions. Now here is the patient, 48-hour post-op with the provisional restorations in place. This is 2 weeks later at the cement appointment prior to removing the provisional restorations. This is what it looked like immediately after removing the provisionals. And this is 1 week post-op.